Hi, my name is Elliot Fishbein, founder of KFMT. We're a specialized physical therapy practice that works with the functional manual therapy approach. Today we're going to be showing a video example of how we work with a patient with shoulder and neck pain.
So I have pain for 5 years in my left shoulder, and it's getting worse. And having a backpack like for 5 hours, it's really painful, and I just need to rest.
Okay. Like that is that if I ask her to turn her neck to the left, she doesn't go very far, and there's a lot of tension that builds up here. When I ask this is by looking at how well she can accept weight into her arm. Because the ribs are kind of pulled up through here, what it does is it pulls her shoulder blade with it, and it can't rest on her ribs. So if she actually lifts something with her arm, she won't have much stability, and all the tension will go here. This is why using a backpack feels worse for her. So a way I can demonstrate this is if I bring her arm here and I say, "Don't let me move you," she has a lot of trouble blocking me. "Don't try to let me move you," and she has trouble with that. If I come to her opposite arm where she does have more stability, "Don't let me move you," you see she has a lot more strength. So with Hila, we saw that one of the issues she had was that her shoulder was kind of stuck shrugged. And there's a joint here where your collarbone meets your shoulder blade, that if it doesn't separate apart or spread, that your shoulder blade can't rest down. So what we're going to do is I'm going to take her shoulder blade and bring it down and get those two areas to see if they can spread a little bit more. And then to loosen it, I'm actually going to have her do a muscular contraction. "Don't let me move you here." And that contraction means I don't have to press harder. Her muscular contraction helps to loosen that joint, let it go. So now I'm going to do a few techniques to try to get her spine to get out of that rounded position and let her ribs translate forward so her shoulder blade can rest. I put my fingers on the spine gently, and then I just lift her elbows and use that as a fulcrum to get tension on her spine, and then say, "Don't let me lift you here." And again, her movement is what's going to actually create the mobilization of the spine. What I'm going to have her do is take your left hand on your right shoulder, and I'm going to have you turn your head to the right, and I'm going to pull this to the right until I feel it tenses under my hand. And I'm right on the rib here, and I'm just giving it a gentle nudge forward, and then I use rotation to mobilize it. Don't let me. Okay, so now that I've done things to allow her shoulder to relax down, I need to get her brain connected to the muscles that keep it down. So I'm going to use something called PNF to help her stabilize, which is kind of a manual resisted form of exercise. So what I do is I bring her shoulder to that down position, and now I want her to kind of connect to that. So now I have her connecting it, and I just make her hold that position so that her brain remembers kind of how to use those muscles to keep it there. Once I've had her hold it for a time, I can have her practice different types of contractions. So now I say, "Slowly let me push you up a little bit," and now gently push back down. And then she pushes down to my hand. Okay, so now that we're done with our treatment, Hila, tell me a little bit about how you're feeling.
I feel much more light, and I felt a lot of tension, and now it's much more loose.
The other thing we can look at is turn your head to the left. And she's gained range of motion, and I also don't feel like she compresses through here. So when she turns, it's likely to be less uncomfortable. And then the last thing we looked at is previously when I loaded her arm, she really couldn't stop me. She didn't have a lot of strength because her shoulder blade couldn't stabilize on her rib cage. Now, hold, don't let me move you here. When I come in there, she's got a lot of strength, and I can push a lot harder. And so that's an example of how we use the functional manual therapy approach to treat shoulder and neck pain. For more information or to book online, visit us at connectedfmt.com.